bring to this community that never existed before, and it's completely aligned with our strategic vision of differentiating the way healthcare is delivered in this region. And we are more than excited about that. We are surrounded by some phenomenal folks tonight. Many of you are donors to this endowed chair. More than 100 contributed to this fund. Hospital physician and nursing leadership, I see many faces from the proud neurosciences team to support Dr. Fishman and his work. Foundation and health system board members are here, as well as the families of Dr. Doug Johnson and Andrew Fishman. It can only be made possible with community support. You folks are why we exist. We're here to serve the community. Doug Johnson passed away just over a year ago. He was an admired and respected physician, phenomenal physician, innovative researcher, a loyal patriot, a devoted husband and father, and a friend to almost every one of us in here, including me. We have got a short video that we're going to show to kind of describe how this endeavor came about. We'll come back to the podium in a minute.
When I started college, we were in chemistry class together. He asked me what I wanted to do, and I said, well, I want to major in biology, but I might want to go to medical school. From then on, he was relentless at encouraging me to go to medical school.
He always gave his best. He always excelled at what he did, taking it to the limits.
He was somebody who drew other people to him, you know, somebody that people wanted to be around, somebody who people wanted to work with.
There just isn't a better quality of a man. So many people felt so good about him.
An endowed chair is, let's collect from donors and give a title to an incoming physician that will be the endowed chair of neurosciences.
The earnings on that would then support the chairholder in ways that could be furthering research related to that field, or clinical trials, or hiring more doctors.
The Doug Johnson Endowed Chair in Neurosciences. It's an opportunity for us to keep Doug's memory alive. It's a way to continue to advance the work that Doug was dedicated to.
From his perspective, there were certain areas that needed development, I think, and he really encouraged the institution to raise all portions of neurosciences.
He was the leader in terms of neurosurgery in the western suburbs. And honestly, the breadth and depth of the programs that we now offer to this community, he helped drive all of this.
I mean, here was a guy who not only was excellent in his field, he was really focused on the patient care.
When I met patients of his, they were very excited to be able to tell me what a wonderful person he was, how he helped them. He motivated all of us. He's just that kind of person, very influential.
I've treated thousands of patients with Dr. Johnson, and they come back and say what a wonderful surgeon he is, how he's changed their lives.
When Doug would come to my office and the door would close, there'd be 5 or 6 people that would congregate outside just to listen. There was always this, boy, what next great idea does Doug have?
After 9/11, he took a leave of absence from his medical practice to join the reserves.
They offered him desk positions because he went in at a high level, and he didn't want a desk position. He said, I want to be in there fighting.
He happened to be sworn in on the day they invaded Iraq. Came back about 9 months later after serving his country well.
It was a passionate calling, and there wasn't anything that was going to stand in the way from him giving back in honor of those who lost their life in 2001.
We have one of the strongest neurosciences programs in the region. Our program is on par with the biggest academic centers in the Midwest.
This is a special place. We have a phenomenal obligation to provide the highest level of care available for the community.
We're trying to do something that isn't frequently done in a community hospital setting. It's exactly what Cadence is all about taking big, bold ideas and advancing them further than they had ever been advanced before.
This endowed chair is going to be the first for the Cadence system. I do think it's going to set the pace for more endowed chairs to follow.
And as soon as we heard about it, we gave a contribution.
It took about 2 minutes. We thought this is the right thing to do.
We just looked at each other and said, how much?
We all know how much he wanted to have a remembrance here at Cadence Health for what he did, and everybody has come together to make it a positive thing and to really carry on what he did ask for.
He taught me to never waste a day, always make it worth your while. And there are those times where I really wish I had his advice. And, you know, his friendship too.
When someone has been so important to you and has healed you and has made a huge difference in your life, it's important to share that sort of goodness with the rest of the world.
He would love to have his name as part of the ground floor of neurosciences in the western suburbs. Help preserve his legacy, help advance the neurosciences program, and support the funding of this endowed chair, because it'll go to good use.